Everyone. Welcome to Hawaii Care Choices Healthcare Talk Story. Good morning. My name is Tish Lopez. I'll be your moderator this morning. We have two wonderful guest speakers presenting today, Lonnie Weigert, Community Relations Manager for Hawaii Care Choices, and Mr. Hilton Raethel, President and CEO of Healthcare Associations of Hawaii. Before we start, I want to ask the audience for a few, if you on Zoom can hear me and see the PowerPoint that is up on your screen, please give me that thumbs up. Unfortunately, due to technical difficulties this morning, we will not be going on Facebook Live, but we will be posting that on our Facebook page right after this talk story. Wonderful. I see that we are coming in clear. Want to let you know that today's Zoom meeting is being recorded so that you and others may access it in the future. To our Zoom participants, if you have any comments at any time, you may use the chat feature or use the Q&A box at the bottom of your screen for any questions to Lonnie or Mr. Raethel. We are doing polls today. So the polling is very simple. There is no right or wrong answers. A question will pop up on your screen. Please make the selection that you think is best and submit your poll. Just to kick things off, I am going to start an icebreaker. Okay, that icebreaker poll is up on your screen. The question is, would you rather stay in a cabin in the woods or a bungalow on the beach? Okay, I see everybody is trying to decide. I mean, things are starting to open up, thank goodness, and maybe I'm gonna find my cabin in the woods. Okay, we are going to end that polling right there. Thank you so much for joining in. Looks like, I'm gonna share the results. 33% of you said a cabin in the woods and 67% said a bungalow on the beach. Awesome. Well, that is how the polling works. We're going to be getting those up during our presentation. So thank you so much for everybody for joining. Oh, sorry about that. We are done with our icebreaker. Now I would like to introduce you to our guest speakers today. We have Lonnie Weigert, who is the Community Relations Manager for Hawaii Care Choices, and our wonderful presenter for all of our healthcare talk stories. If anyone on Zoom wants to chat in hello or aloha to Lonnie, please go ahead, type that in the chat now. We also have Mr. Hilton Raethel. He is the President and CEO of Healthcare Associations of Hawaii, the nonprofit trade organization representing more than 170 members across the state. Member organizations include hospitals, skilled nursing facilities, assisted living facilities, adult residential care homes, home health agencies, and hospices. Mr. Raethel has more than 30 years of experience in the healthcare industry, including 12 years in Southern California and 20 years in Hawaii. He has a BS in psychology, master's in public health, and a master's in health administration. He's also married with 4 children and enjoys stand-up paddleboard and home improvement projects. Wonderful. Thank you for joining us, Mr. Raethel.
Welcome.
Thank you, Lonnie, for taking your time out to be with us this morning as well. And thank you so much for everybody who has joined this Zoom presentation. I apologize for the minor difficulties that we had for this morning. But if you enjoy stand-up paddleboarding or home improvement projects just as much as Mr. Hilton, please send that in the chat. We'd love to hear from you as well. Being that, Mr. Raethel, you have joined us so early and we are so happy. Would you like to go first and share?
I'm fine. Whatever works for you, that's fine. Thank you.
Okay, wonderful. I do have some questions that we have collected prior to this this Zoom presentation. So I would like to ask, what is Healthcare Associations of Hawaii responsible for? I know I mentioned the 170 different groups that it does kind of umbrella and encompass, but can you share a little bit more about that, please?
Yeah, so we're a trade organization that, as you mentioned, represents over 170 healthcare organizations, and our job is to advocate on behalf of our members. And we do advocacy in different ways. We work through the legislative process. So we work with the state legislature, and we also work with our congressional delegation, because we work on advocacy at a local and a national level. And we also advocate in other ways, for example, with regulators like the Department of Health, the Department of Human Services, Joint Commission, all of those regulatory bodies, again, locally and nationally. And we also advocate on behalf of our member organizations with payers and community groups. So our job is to advocate in a variety of ways on a variety of topics on behalf of all of our members.
That is wonderful. Another question that I have is, what messaging efforts are planned to address vaccine hesitancy across the state?
Well, that's a huge issue right now, because we have done really well in the state of Hawaii with our vaccines. We have over about 1.3 million doses that have been given in the state, which is very, very good, but it's not good enough. We still have a way to go. And when I say not good enough, we've not reached that level that we would consider herd immunity. Now, right now, only those individuals who are 16 and above can get the vaccine, because that's all the approvals are for. And well, that's 16 and above with Pfizer, and 18 and above for Moderna and Johnson & Johnson. And we don't have much Johnson & Johnson in the state, which is a single dose shot. We have a lot more Moderna and Pfizer, which is a 2-dose regimen. So that means that most people who are getting vaccinated need 2 shots. And we have a lot of the early adopters. We have a lot of essential healthcare workers. We have a lot of other essential workers who have gotten their shots. But there's still probably about 300,000 people or so above the age of 16 who have not yet gotten their shot. And we are working to just reach out to those different groups. There's a variety of reasons why they haven't done it. Some of it just maybe don't know enough about the vaccines. They may not, not everyone has access to the internet. Not everyone lives close to a pharmacy or a drugstore. So, and there are people who maybe don't have English as their primary language, and just haven't been getting enough information. So we're looking at a lot of different initiatives to talk to people, get out to different groups, and just assure them that the vaccines are very, very safe. And most importantly, they're very, very effective at helping people stop, so they don't end up hospitalized, so they don't end up sick with COVID. And also, so we've had some deaths, and so that it reduces the likelihood of death. So it's very, very important, and so we're working on a lot of different initiatives to get people vaccinated.
Wonderful. It is definitely a large effort. So thank you for sharing all of those wonderful numbers with us. I would like to just let our Zoom participants know, if you have any questions for Mr. Raethel, please go ahead and type that in the Q&A box. But I would also like to ask, in your opinion, Mr. Raethel, do you think employers will require their workers to get vaccinated as a prerequisite to employment?
Well, that's a very challenging topic. Right now, these vaccines have only received approval from the FDA under an emergency use authorization. Now, there's only other one time in US history that a vaccine has received emergency use authorization, and that is the Ebola vaccine. Now, fortunately, Ebola was not anywhere near the issue that COVID is, or COVID-19 is. So no one ever considered mandating the Ebola vaccine when it was issued an emergency use authorization. So the point is that this has never been tested in the courts. Mandates for vaccines under emergency use authorization have never been tested in the courts. Now, for vaccines that have received the full authorization, like flu vaccine and other vaccines, that has been tested in the courts, and overwhelmingly, the courts have decided that that can be mandated. There are a lot of hospitals, a lot of organizations across the country and in Hawaii that do mandate flu vaccines. But that, again, is because the flu vaccine has full authorization from the FDA. Now, we're anticipating that Pfizer which is one of the vaccine manufacturers, will apply for full authorization maybe as early as November. But even if they apply, it would typically take about maybe 6 months to get full authorization. So it may not be until, late spring or early summer that there is any of these vaccines have full authorization. Now, some organizations on the mainland, some hospitals have made a mandate or issued a mandate for vaccines, but we don't expect that to become widespread. What people are trying to do in general and in Hawaii is just provide enough information, enough guidance about the use of the vaccines, their safety, their efficacy, and we're hoping that that will get us to where we need to go.
That is wonderful. I mean, you are just so full of knowledge, Mr. Raethel. I am so excited to have you here. Again, those of you on Zoom, please send us your questions and answers for Mr. Raethel. Of course, we will be answering them live right here on our presentation. Another question, of course, that everyone is asking is, will a vaccine transport be a reality, especially for inter-island and trans-Pacific travelers?
Well, the inter-island, those restrictions are lifting on May 11, and we do expect that the Hawaii governor will issue a clearance for individuals, at least from Hawaii, who have been vaccinated to be able to travel across the Pacific. Now, the challenge is identifying who exactly has been vaccinated. There are people across the US that have been vaccinated in different places. There's different systems for tracking those. And so there is a lot of work being done to figure out how do we collate or collect all of that information, put it into one central repository so that there can be a fairly easy check, just to check to see that someone is vaccinated. And different countries are working on different vaccination methods right now. So it will probably be a little while yet, and by a little while, maybe at least a few weeks, maybe a month or so, before Hawaii residents can travel. Actually, I'm in DC right now, Washington, DC. So I'm heading back on Sunday. So I'm over here visiting family. And so I have to get, even though I'm fully vaccinated and I have my vaccine card with me, because there is not clearance, I'm going to have to get tested later this week so that I can get back into Hawaii without any issues. So the governor's working on that, the lieutenant governor's working on it, the Department of Health is working on it. And we anticipate that there will be some freedoms that come with full vaccination once these systems are put in place to check how, to ensure that someone truly has been vaccinated.
Wow. Well, thank you so much for joining us all the way in Washington, D.C. I know the time zone is definitely different from us as well. So I really just thank you so much for joining us again. I think our audience is just thrilled to have you and are excited to hear what you say. We don't have any questions live from our audience yet. But I know you did mention the age cutoffs. Everyone knows that the Pfizer and Moderna have a 16 or 18 year age requirement. Do you know when or if vaccines for those who are under 18 or 16 will be out, and at approximately what ages they might start at?
Well, Pfizer has already completed some clinical trials for 12 to 15-year-olds, and they have applied for emergency use authorization. So the FDA is reviewing that right now for 12 to 15-year-olds. We expect that the okay for that to come out very soon. It could even come out this week. So if that happens, there are about 55,000 individuals in Hawaii between the ages of 12 and 15. So if Pfizer gets that approval this week, or even maybe next week, then that means that there's a lot of young people who can come in and get vaccinated. So that's 12 to 15-year-olds. Now, Pfizer and Moderna also have other trials going on And they have trials going on right now with humans because they go through different levels of trials. And they have trials going on right now all the way down to 6 months old. So they are working on from 6 months old, not doing any trials under 6 months, but from 6 months old children or babies up to 11 years old. Those trials are going on right now, but we anticipate it will probably be a while. It could be even as long as next year, early next year, before those trials are completed and we're able to get children younger than 12 vaccinated. But the good news again is that for the school year starting in the fall, we anticipate being able to get, or we would like to get, as many of those 55,000 individuals or children between 12 and 15 vaccinated as quickly as possible, so they can go to school at least, and we can help protect at least that group of students. Right now, there's a lot of 16 to 18-year-olds who are getting vaccinated, which is really good. And so it's, we're looking to protect as many of these young people as possible.
That is wonderful that all of this is still happening, and science is still on our side. So thank you so much for sharing that. I do have a question from our audience. Are there still active cases of COVID-19 in local skilled nursing facilities or similar institutions?
Well, we're very fortunate that we have done really well as a state. I know we've had some issues in a couple of facilities, but overall we have done very, very well as a state in terms of protecting both our workers and our residents in our long-term care facilities. Now, based on the latest study we did, which was just within the last 2 weeks when we did a survey, over 90% of the residents in our long-term care facilities are fully vaccinated, and over 80% of the healthcare workers in our long-term settings are also fully vaccinated. Now, that is excellent news, and it's much higher than many other places on the mainland. Now, because COVID is still out there in the community, we still have, on occasion, we've still had, even though most people are vaccinated in our long-term care facilities, we've had some very small breakouts. However, because overwhelmingly people are vaccinated, that means COVID is not going to spread in these facilities because people are vaccinated. It can't spread. And so, we've had a couple of cases, but just one or two. And if that happens, those individuals are isolated for a couple of weeks, just like we were doing earlier before the vaccines were available. So it's still out there. The challenge we've got is that so many of our residents in our long-term care facilities, they've been shut off from their families and friends for such a long time because of this pandemic. And the federal guidance has come. The federal guidance has come out that there should, that they should be able to have visitors, they should be able to have family and friends. So now, and we want to encourage family and friends to come in and see, but we want to do it in a safe way as possible. And the more people that are vaccinated out in the community, the more of these friends and family members that are vaccinated, the safer it is for our residents. And that's another reason why we want to get many people as vaccinated as possible, because we know these family ties. We want the kids and the grandchildren of these residents to be able to visit their loved ones. They've not been able to do that. And we want to, work on ensuring their mental health, and so they can just socialize with people.
Yes, definitely. And on that note, another question came in: is vaccination a requirement for new admissions to skilled nursing facilities?
Well, it's not a requirement, but it's highly encouraged. We're doing all that we can. We know how devastating this disease is, especially for elderly people, many of whom are frail, or they have other, they might have hypertension, diabetes, cardiovascular disease, So they're already in a vulnerable state, many of them. And so we want to be able to protect them. We want them to live as long and happy lives in these care facilities. And so that's why we've been pushing so hard to get everyone vaccinated in our long-term care facilities. And our staff have responded to that call and got vaccinated, and our residents do too. So we're making, if someone is newly admitted or is about to be admitted to a long-term care facility, if they're not vaccinated, we can make it, and they choose to be vaccinated, we can choose, we can ensure that they are vaccinated. Now, if they're not vaccinated, and that's a choice, right? We understand that. There's some people choose, and for some people, it's a very small number, there could be a medical reason why they're not vaccinated. But if they can be vaccinated and or if they choose not to be vaccinated for whatever reason, when they go into one of these long-term care settings, they will be isolated or put in isolation for 2 weeks. And the staff that would come in, they would be wearing full protective, the full PPE, personal protective equipment. And so we would just need to make sure that for 2 weeks, just in case they got exposed, so these individuals would be tested, but they would be isolated for 2 weeks to ensure they're not COVID positive before they mix with other residents and staff in that setting.
Excuse me. Thank you so much. I'm glad that all those precautions are being are in place for the safety of all of us. On the travel passport, will there be a CDC or government database that's being created specifically for airport officials to check in?
Well, that is one of the things that's being worked on right now. Now, everyone who is vaccinated, their data does get entered into a federal system. But the federal systems, you have all these different agencies. So just because one agency has the data doesn't mean it necessarily can be shared with others. There's issues about, confidentiality, HIPAA, which is, confidential about patient information. And so the federal governments and the governors are all interested in making this work. So they're working on systems to make it work. But right now we don't have a system. But there is a lot of work being put into figuring out, well, how do we protect the confidentiality of individuals, but at the same time have a safe and robust system and make it fairly easily accessible so that, airport screeners, other individuals, if necessary, can access that. So it's being worked on, but we don't have it just yet.
Okay, wonderful. Thank you so much for that, all of that information. Before I let you go, I have one last question, and that is, why are you a proponent for palliative and hospice care? Can you share that with us?
Yes, certainly. I have been, as you mentioned in my intro, I've been involved in healthcare for a long time. And in the choices, people having choices, I believe in there's a lot of things that we can do. We do a lot of things well in healthcare in the United States, but there are certainly improvements that we can make. And in one of the areas that has not had enough time and attention given to it over the last, few decades is palliative care and hospice care. Now, fortunately, there's a lot more attention being given to it now. But, there used to be, for example, with insurance companies, people who are close to the end of their life, who are sick, very sick, or very elderly, they had to make choices. Were they going to continue to, receive what we call curative care or life-sustaining care, or were they going to go to hospice? And that was a really hard choice for individuals to make. And that, to me, that was a terrible choice. And we should never have made people make that choice, because if people want to continue seeing their doctors, their cardiologists, their pulmonologists, whatever it is, right up until the end, that's fine. They should be able to do that. So I have been a big proponent in all the different roles I have of giving people choices, of giving people options, of giving people information, because we've not been good about sharing information. All of us are going to die eventually. And we need to understand that, and we need to break some of these taboos. Now, I know it's hard for some people to talk about it. I know it's very uncomfortable, but just because it's uncomfortable doesn't mean we should do it. Everyone should have a choice about how their life ends. They should get to choose. Do they want to do it in a setting, in an institutional setting? Would they rather spend their last days, weeks, months in a home setting or some other setting? It should be a choice, and we need to give people options. So I That's what I'm a proponent of. I'm a proponent of information and of choices and of families and individuals at the end of their life having good and open discussions with their families, with their caregivers, with the health community about what the choices are, what the options are, and let people choose what they want to do. If we don't give them a choice, that is what I'm really frustrated at.
Yes, and I do have one more. I know we have 2 minutes, so I just really quickly would like your answer on what do you think are the main barriers to accepting hospice care?
Well, I think a lot of it is, well, there's a couple of reasons. One of them is a lack of information, but a big problem is still people are uncomfortable talking about dying. It's like, well, if we don't talk about it, we won't die. Well, unfortunately, it doesn't work that way. We're going to die whether we talk about it or not. So one of the biggest barriers is just, accepting the fact we're all going to die and making peace with it and saying, look, okay, we're all going to die. It's going to happen to all of us. It's not that big a deal, right? It's going to happen to all of us. So let's deal with it and let's be prepared and let's talk to our families about, okay, what do you want to do? Talk to each other. Do our children know what we want? Do our siblings know what we want? Do our caregivers know what we want? So it's just having those comfortable conversations about and taking some of the fear and some of the trepidation away from just having those choices. So I really think that lack of ability to talk about death and dying is a really big impediment to people being able to die in the way that they choose to die. So choice, again, I really believe that not everyone is going to be in a cognitive state to make choices, but that's why you should talk about it, while you can have the ability to make a choice and not wait until, you're 95 years old and say, look, well, now I'll think about it. That's if most of us hopefully will get to live to 95.
Yes, definitely. And I agree. Communication is key. Having that conversation earlier is definitely so important. Thank you so much, Mr. Raethel, for your time and all of your knowledge and opinions on all of these subjects that we discussed today. Thanks for tuning in from Washington, D.C. also. So we really appreciate that and appreciate you. I do not want to keep you longer than we have promised. So I would say aloha. Thank you so much for joining us on this Healthcare Talk story this morning.
You're very welcome.
Take care.
Bye.
Aloha. All right. For those of you that have been on Zoom with us, that was just an enormous amount of really, really great information. I hope you guys got something, learned something new. I know I did, for sure. Thank you for sending us your questions to ask Mr. Mr. Raethel. But without further ado, at 10:31, I'm going to hand the microphone right over to Lonnie Weigert.
Thank you so much. Aloha, everyone. Wow, there's so many of our friends that are on the call. Thank you so much, you folks, for joining us every month. 10 at 10, here we are. And thank you for all of those questions. What I think is so amazing now that we're doing things over Zoom, we can pretty much ask anybody. It doesn't matter where they are. Hilton Raethel is probably one of the most interviewed and viewed medical authority in the state of Hawaii. And the fact that we were able to get him here in our little old town of Hilo is just amazing to me. And here he is, just dialing in from Washington, D.C. I feel so very, very grateful. And I'm very grateful that all of you folks have joined us as well. So on that note, his final note with regard to, he wishes that people would always be given choices. And that's why I share with you again that although we were called Hospice of Hilo, we decided to change our name largely because we added palliative care to our 3 programs. And it was because Hawaii is where we provide the service. Care is at the center of everything we do. and choices. Choices, my friends, are the gift that we give to our community. The choice is yours. And I really agree with him that a lot of the families, if they would just talk about what types of plans that they would like for their loved ones, you know, before anybody is sick, and then they can really plan and give their wishes to their loved ones, it really puts a lot of stress off of the loved ones who remain. So anyway, great information that he gave us. Gosh, he just really went for it. Thank you again for joining us. So let me just share the three main programs that we offer is palliative care, hospice care, and bereavement care. So palliative care, the focus on that is always going to be on relieving discomfort. And that's because with palliative care, you don't have to have a end of life prognosis. It's about trying to ease some of your discomfort from really serious illness. Hospice care is all about focusing on really supporting the family, allowing people to live the life that they'd love to live really at that point, and focusing on comfort. And then again, bereavement care for those who need the support after a loved one has passed.
That is wonderful. Everyone on Zoom, if you could just give me a thumbs up if you know someone that can benefit from one or more of these programs.
Thank you. And what is palliative care? So for the most part, a lot of people they've never even heard of the word palliative, but palliative means to ease, to alleviate, to relieve, and to soothe. And so palliative care is normally called upon when somebody is dealing with a serious illness, such as cancer of any type, COPD, congestive heart failure, and kidney failure, normally in the final stages. And so when somebody is dealing with, you know, one of these life-limiting illnesses, relief is definitely needed because a lot of these illnesses have treatments. And with those treatments, there's always this discomfort, nausea, you can't sleep, the pain, there's just chronic pain. Anyway, this is when palliative care is the most useful, and it's all about boosting the quality of life for the patient and the family.
Audience, if you learned that palliative care boosts quality of life for patients and families, give Lonnie a thumbs up.
Yay! Awesome team, awesome. And of course, anyone that is dealing with serious illness is definitely appropriate for palliative care. So we really suggest a diagnosis, and largely it's because it really allows the patient and the family to get to know what palliative care is all about. Kind of just hang your legs in the, you know, shallow part of the pool kind of thing, to just get to know the whole idea of palliative care. Most people have no idea that palliative care can be provided to a person of any age, even children. And people will continue to get treatments if that's what they wish. Bottom line, though, is that people are living very active lives when they're in palliative care. So terminal prognosis or diagnosis is not required for palliative care.
And if you know anyone suffering from these specifically for palliative care, raise your hand and let us know. Okay, there is that brain teaser. It is up on your screen, should be right now. There we go. The goal of palliative care is to improve quality of life for patients and their families. True or false? Again, just want to say thank you so much for everybody, everyone who is participating in our polls. I'm sure you had your coffee this morning or tea. All right, we have everyone voted. I'm going to end the polling right there and share the results. The goal of palliative care is to improve the quality of life for patients and their families. 100% said true. Awesome, wonderful. Back to you, Lonnie.
Thank you, Tish. And it's absolutely true, 100%. That's exactly what palliative care is all about. And I saw that Auntie Jessie had a question over here on how palliative care is covered. We're going to cover that in the next few slides, so I'll be sure to bring it up then. So anyway, when people need palliative care, what happens is that you can physically see some changes that are going on with your loved one. Maybe they're tending to go to the emergency room more often. They're calling their doctor at different times. of the day, even in the evening. They tend to have difficulty managing their medications, and largely it's because now they have all kinds of medications. And what is really apparent is that they tend to diminish in their activities of daily living. So, managing their finances, driving, going grocery shopping, preparing meals, even light housework become quite challenging. And of course, the pain, the fatigue, swelling in the feet and legs, sometimes the nausea, all of these symptoms can be physically seen. And therefore, maybe if you have somebody that has this, they may need palliative care as well.
Yes, and for those of you who feel that excuse me, raise your hand if this helped you know when palliative care is needed. Thank you so much, audience.
Thank you, Tish. So when should it begin? The doctors that we talk to, like our Dr. Dolan, she will say at time of diagnosis. And like I said, it's just to get to know the whole palliative care team and what palliative care is all about. The team would be with the patient and family throughout the course of the illness until they are not needed anymore, or if the patient transitions to a higher level of care. And so basically signing up early is the way that we strongly recommend.
All right, thank you so much, Lonnie. Please give me a thumbs up if you believe those with serious medical issues could live longer by signing up early.
Thanks, Tish. I thought I lost you there for a moment. I'm glad you're back. Okay, I love this technology, don't you guys? I mean, there are days that we want to just strangle it, but we just go with it. Anyway, what to expect when the palliative care team comes? Oh my God, our palliative care team is so awesome. They will come to your home or your loved one's home or whoever that that might be able to get palliative care, or they may want it. So the nurse comes to the home, evaluates the patient's health and medical history. But what's the biggest thing is that they really want to know what's the patient's biggest concerns. I mean, what's the patient's goals? That's what they want to know. Like, is it, I want to make sure I see my grandson graduate next year. I want to go to the Disney World vacation with my grandkids. Or something really simple, like I just want to get off the couch and be able to walk to my mailbox in the front yard without huffing and puffing and not being able to breathe. So in any case, sometimes it's as simple as that. Educating the patient and family is really critical part of our care team as well. And it's because, maybe you can't breathe because you are eating too much Spam and Portuguese sausage. I mean, I doubt that would ever plague anybody on this call, but I'm just letting you know, sometimes that happens too.
I do like my Spam and rice, Bonnie. And maybe that slowed me down a little bit this morning. Raise your hand if you would like this type of service for your loved one.
Awesome. Thank you, Tish. Oh my gosh, medication review. So what happens, particularly in palliative care? I mean, hospice, it happens too, but more so in palliative care, where people will go to their primary care physician and get medication for whatever it is that they're ailing from, and then they'll go to maybe their cardiologist or whatever ologist, and they'll get more medication. Oh, and then one night there's some kind of incident, they got to go to the emergency room, and then they get some more medication. After a while, after they go see all their specialists, etc., they get all of this medication. So like this couple over here balancing all the medication, that is for real. We will go to people's homes and they'll have a whole coffee table full of medications. Of course, some is expired, some, belongs to their deceased ex-husband. And then there's some that belong to the adult children that no longer live there. But make no mistake, nobody throws any of it away. So medication review is a very important part of our palliative care program. And we come in and help people fill their pill box and make sure after we speak to their primary care physician that they're only taking the medications that they absolutely need to.
Yeah, please type yes in the chat if you can relate to this couple in the picture balancing the medications, or if you know a loved one that can.
Thank you, Tish. So how does palliative care work? Okay, so first of all, somebody is dealing with a very serious illness, which I mentioned: cancer, congestive heart failure, COPD, renal failure. So that's one. Then now they're going to the doctor, and the doctor is saying, well, you can take these types of treatments. Okay, but they have to go to more than one doctor, and they have to go here and there, etc. With these treatments comes discomfort oftentimes, and that's where palliative care comes in, where we try to really manage the pain and discomfort that is associated with all of these treatments that happen because of someone is dealing with a serious illness. We also create that plan of care. And remember, I tell you, everything is based on what the patient really wants, because their wishes is number one. And of course, in our team, our social worker will help people fill out their insurance forms, help them with an advanced healthcare directive so that their loved ones will know their wishes of the patient, and also provide spiritual care if that is needed.
All right, everyone, please raise your hand if you think this is just an amazing program.
Okay, so how is it paid for? So palliative care is pretty much paid for by the insurance that the patient has. So if the patient has Medicare and Medicaid, there isn't going to be a copay at all, as is when you go to see a regular doctor. If there is only one type of insurance, normally there could be a copay anywhere between $20 and $40 for the visit of the provider or the social worker. Otherwise, all of the other visits are included in the care of the palliative care team.
And please type yes for our friends joining us on Zoom if you now understand how palliative care is paid for.
Yay, Auntie Jessie. And if you need more information, you know, girl, you can come directly to me. Thank you, Auntie. Okay, what is hospice care? So hospice care is different from palliative care. I mean, it's close, but it's different. You know, hospice focuses on comfort, where palliative care focuses on relief. The philosophy of hospice care is different too, because hospice care is focusing on quality of life, not quantity. Sometimes we have people that will continue treatments so that they can prolong their life. However, their quality of life just goes down the tubes, meaning they either can't eat, they're losing so much weight, there's so much pain dealing with all of these treatments. So yes, once people come to hospice care, it is all about comfort and the quality of life. And really, hospice was created to ease terminal suffering. And that's why we say that many times death is not the enemy. You know, anytime somebody can really be soothed and eased and comforted, it makes all the difference in the world. And hospice is all about helping the entire family, not just the patient. And really, if people can come to us as early as possible, that is what we're really trying to get our message out on.
Yes, and send us a comment to tell us if quality or quantity of life is what you want for your loved one.
So we have a hospice care team. Oh my gosh, our hospice care team is so great that will come to your house. I mean, who doesn't want full-on experts coming to your house and taking care of you and your loved one and supporting you folks as well? It's really a very important thing. And if we're able to come there early in the diagnosis of your loved one, we're able to provide quality of life, not only for the patient, but for the entire family as well.
Oh, there it goes. My mute button is on there. Type yes if at end of life you want this type of expert support for your hospice team.
Oh, I see. I got another comment from Auntie Jessie. We don't actually come out to Ocean View with regard to having a team go out there. It's because Kona Hospice takes care of Ocean View all the way to Kona. We only go as far as Ka'u on the what is that road? The one to the beach. Anyway, we only go that far, and then Kona Hospice takes over. So who qualifies for? Yes, South Point Road. Oh, Auntie Jessie, you're so awesome. Yes, South Point Road. We only go as far as that. So our coverage is from Lapoihoi Point all the way to South Point Road, all the way to the ocean. Yeah, that is our area. Thank you so much for asking that. And who qualifies for hospice care? So there's these three things. First, the primary care physician needs to give their best guesstimate that the person is suffering from a terminal illness. Second, the doctor will give his or her best guesstimate of 6 months to live. And third, the patient is no longer seeking any kind of curative treatments or surgery. So those are the three items that qualifies a person for hospice care, no matter what the age, So these are the three items.
Thank you so much for everybody for interacting with us this morning. If you now understand how people qualify for hospice care, raise your hand or type yes in the chat box. And with that, we have our third polling. So the question up on your screen is, hospice is where you go in your last days. True or false? All right, I see some questions getting in there.
Yeah, I see them. Be sure to ask those questions, Tish. I'll answer them as we go.
Okay, sounds great. And I'd like to say, if any of you have questions for Lonnie, please type that in the Q&A box as well. All right, we're going to end the polling right there and share the results. Hospice is where you go in your last days. 22% of you said true and 78% said false. Thank you so much for joining us. Remember that there is no right or wrong answer. Back to you, Lonnie.
Thank you so much. And for anyone that said that, yes, that's where you go in your last days. No, I want you to know, I want you to call us as soon as you can. We don't want your loved ones coming to us in their last days because we won't be able to help you, the caregiver. Okay, so the whole thing about it is we'll be able to give quality of life to your loved one because they'll no longer be in any kind of pain. But we need to support the family too, because, it's very, very difficult to build the resilience when somebody is going to pass. The whole family has a really tough time. So you call us as soon as you can, okay? Hospice is definitely a place that you would call early because we are all about living. So when it's time for hospice care, again, there's some physical changes that you see in your loved one. First of all, they're going to the emergency room or wanting to see the doctor a lot more. They tend to be losing weight, and they also are quite frail now, so they'll increase in falls, etc., which is really dangerous, broken hip, all of this. So definitely if you see that your loved one is becoming a lot more frail, call us. And then they have difficulty getting out of bed, or maybe they don't even want to get out of bed. They just sleep all day long. And you'll notice too that their skin starts to really become thin. And then, they have different sores or cuts or different infections. All of this are signs that you need to take your loved one to the doctor and determine whether they need a higher level of care. And if you're on palliative care with us, which is called kupu care, then rest assured that the team will let you know if your loved one needs to have a higher level of care. In fact, those discussions are going on throughout your care on palliative care so that the family can make a very informed decision calmly and for the best of their loved one.
Yes, and comment yes down in the chat box. If you like what Mr. Raethel said, that communication is key and talking about it early is important.
So how does hospice care work? Well, first of all, you need to have a caregiver. Okay, so we don't come and live inside your house and stay there 24/7. We have a team that comes to visit you, and we will come to visit based on how sick your loved one is. If they need more visits, then we will visit more. But for the most part, we will be teaching the caregiver how to care for their loved one in between our visits. We will also provide all the medications, the medical equipment, such as the bed, the shower chair, all of that. And a person can keep their primary care physician. I remember when my dad said that he just wanted to pass it home. And we thought, oh, piece of cake, Dad, we can handle that. And then he had congestive heart failure. So one evening he couldn't breathe, and we called 911. They took him to the hospital, and he passed by the time we got there. So, oh, that was such an epic fail. So years later, when my mom was diagnosed with lung cancer, her doctor said to us, thank God for a doctor. He brought it up to us and said, oh, your mom qualifies for hospice care at home. And so my brothers and I, and we are a big Hawaiian family, 8 of us. And so me being the youngest, I go and I ask, so what is this hospice? And so then the doctor explains, and I said, oh, no, my mom is not going to go for that. There's no way. I said, she's such a stoic Hawaiian woman. She's going to say she doesn't need it. Well, sure enough, I go home and I tell Mom. I said, oh, so Mom, guess what? The doctor said you can have hospice care at home. And she goes, what? Hospice care? I don't need that kind of hospice care. I don't even like that word. Why you brought it up to me? I said, oh, so you're not about it? She goes, no, I don't need that. I don't need that. I said, oh, well, because brother's already renting the wheelchair for you. And, I heard we can get free stuff. Oh, yeah. Like what? So, of course, it just changed her tune. And when I told her, I said, yeah, Mom, I heard it's all included. So she said, well, I'm sure it's a gimmick because nobody gives you all that free stuff. And I said, no, the Medicare pays for it if you have hospice at home. She goes, what? The government? Oh, more. You better go check. I don't think so. So I said, okay, Mom. So if I check and they tell me that it is all included, including your medications, Mom, you want to go for it? She goes, well, I guess we got to go for it. It would be stupid if we pass it up. I said, okay. So anyway, of course, it was included. And we did sign up for hospice. And it was just absolutely wonderful. So as the months went on, and of course, my mom lived longer than her 6 months prognosis. She then tells me, oh, I'm so sad. Daddy didn't get any of this. I said, yeah, I know. We didn't know. The doctor didn't tell us. She goes, yeah. I want you to go out now. You go tell all these people in Hawaiian Homes right now about this hospice, because I know they're not going to know and they're going to lose out on all this benefit. I said, well, it's kind of awkward, Mom, for me to go in there now and go mention, especially if none of them are sick. She goes, oh, yeah, okay, I got it. Yeah, okay, but you figure out when you can go out, tell all these people, because I really want people to know about all this benefit that we got. We would have never had this if we didn't know about it. I said, well, Mom, I'll think how I can get out there. Yeah, you go out there, you figure out how you're going to tell everybody. You promised me you'll do it. And so 10 years later, here I am telling as many people as I can about this wonderful benefit of hospice care that not only helped my mom, but helped our entire family. And so I don't really do this job because it's a job. I do it because it was a promise to my mom.
Lonnie, I've been with you on all the healthcare talk stories. That story never gets old. Send Lonnie all your comments for just the wonderful story that she always tells, but in a different way too.
Okay, so what to expect when you sign up for hospice care. So our team is going to come. We're going to go to your home. We're going to meet everybody, your caregiver, all of that. We're going to find out what are your goals so we can create a patient-centered plan. What that means is basically the plan is all going to be about you and or your loved one's goals. And then the plan will determine how often we're going to come and who of our team will come to the house to care for you. So maybe it's a home health aide, maybe it's a spiritual counselor, you know, maybe it's our nurse practitioner, whoever it is, it's going to be in your written plan of care.
All right, everyone, send me a thumbs up or raise your hand if you learned something new. And we have our next polling, should be up on your screen now. The question is, my culture expects me to care for my family with healthcare needs at home. Sorry for that typo, ladies and gentlemen. Strongly agree, neutral, disagree, or strongly agree. While those answers are coming in, Lani, you are just having an overwhelming love from our audience saying that you are awesome and amazing. And we have a comment from Nick. Here you are, Lani, and doing such amazing work to fulfill that promise. Well said, Nick. I agree.
Love you, Nick. Oh my gosh, Nick is such a solid, I tell you. Okay, so if we have other questions, Tish, you go ahead and ask them in between so that we can get them all answered.
Sounds great. Okay, I'm going to go ahead and end that polling and share the results. So 33% of you said strongly agree, 25% of you said agree, 33% of you are neutral, and 8% disagree. 0% strongly disagree. Thank you so much again for joining in our polls. Back to you, Lani.
Thank you so much, Tish. You know, that's a really interesting question because I remember one of the reasons why my mom wasn't about hospice is because she was raised to believe that the family needs to take care of the family. And so there isn't an outside entity that comes to the home. But once we found out how fabulous the hospice services were, you know, for me, it actually made a difference with regard to me being a better daughter to my mom, because I wasn't so wrapped up in all of the, you know, make sure that, you know, she gets this pills and, oh, how come she has this pain and all of these things. I mean, you get so wrapped up in it that you forget that you're actually a family member to your loved one. And so don't feel ashamed or pressured that, oh, if you go and you ask for help, that, you know, puts you in a bad light. Contrary to that, I tell you, our family was so appreciative that we did ask, because we asked for help from the experts. We didn't try to act like we knew what we were doing when my mom got very, very sick. We knew we could do it because we had the support of hospice with us. So fear not, my friends. You just go ahead when it's time that you need somebody to come in to help you with your loved one. Do not hesitate to call us right away. And so for those who might not know, we also have an inpatient care facility. And this one is Pohay Malama, which is right in the middle of town. And this is not a long-term care facility. I mean, it's clearly the Mauna Lani of hospice for sure, but it's only for short stays. People come here if their symptoms are out of control at home. And so they come here and we help manage those symptoms. And as soon as we do, then we send them right back home. If for some reason they continue on their progress of their disease, many of them will pass here. And it's such a beautiful, beautiful place to be. But yes, hospice care is covered with regard to the services. However, the room and board is not covered here. So for those who have double coverage insurance, meaning Medicare and Medicaid, Medicaid would cover the room and board. And then, of course, for those who don't have Medicaid, we also will offer private pay as well.
Yes, please type yes in the chat if you would love a virtual tour of Pohay Malama to learn more.
And how is hospice care paid for? Oh my gosh. So if you folks are able to get hospice care at home, go for it. Oh my gosh, that's what was the beauty of it all, is we didn't have to pay anything at all. Now, if my mom had to go to a care facility, she also had Medicaid, so we wouldn't have had to pay for the room and board. So if you don't have Medicaid, please look into seeing if your loved one qualifies for that too, because it's a great insurance to have as well. Also, hospice care coverage at home is also covered under any of the other insurances here that are listed. So pretty much everybody offers hospice care at home, that coverage.
A question came up, Lonnie, does HMSA pay?
Yes, yes. So HMSA would be under all the private insurances as well.
Wonderful. Raise your hand or type yes in the chat if you love that hospice care at home is 100% paid for by Medicare.
Oh, and here is our trained volunteers. Okay, so many of the trained volunteers are, I mean, it's just, they're just angels sent to us, because really a lot of times the caregiver, they just need a break. And oftentimes when we would call to offer a volunteer to come and help, the caregiver doesn't want, because they, of course, are dealing with the same cultural barrier as, I'm supposed to do it all by myself. No, that's absolutely untrue. You're supposed to get rest. You're supposed to go Walmart if that's where you want to go. You're supposed to go, work in your garden if that's what you want to do. But we will provide the trained volunteers. And I mean, our trained volunteers, they pretty much do anything. Like, so they will definitely, watch the TV with your loved one, or they'll play cards, or they'll play music, whatever. But they'll also drive them to go look the beach, if they were fishermen before, or there's so many things that the volunteers will do. Hey, they'll come and throw in a load of laundry or help you fold the clothes. I mean, this is why I'm saying that there's so much support that hospice provides. Do not turn it down. That's why you want to sign up early. I mean, we had some ladies that moved in from Florida. They moved to Kona, and they were just talking about it over, a cookout, saying, "Oh, Mabel, when you can sign up for hospice?" "Oh, I don't know. I think next week, because I'm going to a graduation." I mean, they're actually talking about it that casually, because they understand how much benefit they get when they sign up for it, and they're not about to lose it. So only people in Hawaii think, "Oh no, don't call hospice because it's going to hasten our loved one's death." There couldn't be anything more incorrect in that statement. Okay, so don't let all the people from the mainland come here and take all of the hospice benefit. You go and sign up for hospice for your loved one if they need it right away.
Yes, I agree. Lonnie, we have a question to clarify for Po'aimalama room and board. Is it Medicare that pays for room and board?
It is Medicaid. Okay. So there's Medicare and there's Medicaid. So Medicare at home, 100% covered. But if you come to Po'aimalama, there's room and board, and that needs to be covered under Medicaid. Okay. Thank you for that clarification.
Yes, thank you. We also have a great question come in about volunteers. Are your volunteers able to visit families during this COVID-19 time, and are they able to go into the care facilities?
So our volunteers at this time will go to all the homes, because most of our volunteers are vaccinated, as well. And everybody goes in with mask and all of that. Right now, we're not opening it up to our long-term care facilities, as we wait for them to open up a little bit more as well. But yeah, when they do open up, we will send our volunteers there too. And I tell you, it is amazing how the patients just love when the volunteers come.
Lonnie, we have a question that asks, do volunteers have to be vaccinated?
No, they don't, but we offered it to them when our entire clinical staff was offered the vaccine. So most of them decided to take the vaccine, largely because all of them are retired. So we're lucky in that regard that many did opt to take the vaccine.
Yes. And with that, can I just give a virtual round of applause to all that our volunteers do for our patients? Yay.
So bereavement care. Okay, now I got to tell you guys this about bereavement. So let's just say, okay, because I really liken bereavement care and the services of hospice to the services of travel. So let's just say, you know, since all of us are going to go, like Hilton, Raethel said, I mean, we're going to die anyway. We may as well plan on it. Well, let's just say that all of us are going to be scheduled on Heaven Airlines. Some will go at noon, some will go at 2 o'clock, some will go at 8 p.m., but make no mistake, we're all going to go at some point. Okay, so for those that are on hospice care, they will go directly to the first class cabin. And the reason they'll go to the first class cabin is because that's where all the care and comfort is. And they'll not only go there by themselves, they'll go with the whole family. Sadly, those who are not on hospice, for whatever reason, they will not go to the coach class of the airplane. They'll go to the baggage compartment of the airplane. And the reason they'll go there is because that's the coldest, roughest, horrific ride to the end. And by the time they get to the end of the rainbow and their loved one passes over, the rest of the family has to take that horrible ride back. And when they come back, many of them have broken into so many pieces that it's very, very difficult for them to pull their lives back together. So here we have bereavement care. For those who are on hospice care, there are 13 months of bereavement support that we provide to the families. And for those who maybe aren't on hospice, you know, they had an unexpected death, maybe car accident, etc., that happens, we do provide community support for them as well.
Yes, and if you feel that anyone that may benefit from bereavement care, please give our offices a call, and I'm going to type that number right there in the chat box.
Okay, so here it is, our mission, and really our mission is about improving the lives of anyone that we touch, and we just want to offer our support. And you know, just like Hilton Raethel said, it comes down to education. A lot of people just don't know that all of these things, all of these services are out there. And so I'm committed to continue to just keep doing this to get that word out. And if you could help me by telling as many of your friends to tune in on the 10th of every month at 10, so that they can learn all of this information for their loved ones as well. And again, like I told Auntie Jessie, our service area is from Lapahoehoe Point to South Point in Ka'u.
Yes, and we want to know where you all are tuning in from. So please type that into the chat box.
Okay, so this is really important. It's the phone number that you can contact us at. So people will call us and they'll call us direct and speak to our just super duper team that answers the phone in our admissions department. And also patients will go to their doctors and the doctors then will call us. So either way, you know, the doctor, your primary care physician, is always going to be the lead on our team. And even when you come into hospice care, the doctor you can still opt to keep your doctor if you wish. We have a boatload of doctors now. So, you know, make no mistake, we'll be there to help you and allow you to have whatever choices you decide. But yes, you can either email us or you can call us directly or you can ask your doctor.
Wonderful. Thank you so much for sharing, Lani. I want to say thank you everyone who's tuning in from Keau, Hilo, Volcano, Oahu. Thank you so much for tuning in to this virtual healthcare talk story today. A very special mahalo to our guest speakers, Mr. Hilton Raethel, for his valued time and, oh my goodness, knowledge in so many things, and helpful perspectives and updates that he shared in today's talk story. Right now, I would like to just pull up one of our last polling. It is actually a survey. It is 8 questions that will pop up on your screen. If you can make the best selection for all 8 questions and then click submit at the bottom below. Mahalo for tuning in. And I would just like to share that we would love to get your feedback on our presentation for today. Your input will allow us to gain a better understanding of how we can best serve our community with presentations like these in the future. And also just ask wonderful guest speakers like Mr. Hilton Raethel to join us as well and share his knowledge with all of you. If you feel you've benefited from this presentation, please let your friends and family know that they're welcome. Again, as Lonnie said, the 10th of every month at 10 o'clock. You can just RSVP to myself for the Zoom link, lopez@hawaiicarechoices.org. All right, I see everyone is doing the polling, or excuse me, the survey. Thank you so much. Lonnie, I just wanted to share a beautiful comment from one of our participants. It says, to know how this is applied to you and your family, Lonnie, was very powerful and important for those who are learning this information. You make it real for all of those who are listening to your experiences. Thank you for incorporating this into your presentation. And that is from Alan.
Oh, Alan, you're just the bomb. Alan, thanks so much for joining us again. We just love having you. Thank you. Thank you so much. And I also saw a comment from Gail Koho'okele. And I don't know if, I mean, no pressure, Gail, to put you on the spot, but I don't know, Tish, if you're able to unmute Gail, but I wanted to ask Gail if she could kind of update us a little bit about what's happening over at Halea Nui Nui, because Gail was a guest on our show previous to this, and she was a wonderful guest with a lot of information. And so Gail, if you could just, while people are finishing their exit survey, can we unmute Gail and see, like I said, Gail, of course, no pressure, but because you're just such a great friend, I just thought I would really love to hear what's happening over at Halea Nui Nui so everybody can learn.
All right, go ahead, Gail. Aloha.
You can hear me now, right? Oh, sorry, yes. I can't figure out how to get the video turned on here. It's okay. Anyway, aloha, everybody. I'm thrilled to be able to be part of this call today. And Hilton is one of my favorite guys. He has seen us through thick and thin this last year and a half. So thank you so much, Hilton, for everything you've done for us out in the field. I don't know what we'd have done without you guys leading the charge for all of us. So thank you there. Halea Nui Nui, I'm happy to report, is doing very well. We have had the blessing of having no virus at Halea Nui Nui since all of this madness began. So again, I'm thrilled about that too. We still take this very seriously though. So we are constantly doing checks and following up with our staff. But as the regulations have sort of receded a bit and things aren't as stringent as they had been, for obvious reasons, a good thing. We are very careful as we are walking down that path to go back to whatever the normal of this week is. So anyway, I appreciate your asking, but yeah, we're again very blessed and very thankful to all of our staff, residents and families here at Halea Nui Nui, and we're all safe and healthy and happy. Thank you.
Thank you so much, Gail. Thank you. I mean, not anybody can just bring it, Gail, where I just shout out on them, but you can do it, girl. I love it. I love it.
You're too kind. Thank you, Lonnie. Good to see you guys.
You too. Thank you, Gail.
Thank you.
All right, we got another. Thank you both very much. Thank you, excuse me, Gail, for sharing again, as Lonnie said. Looks like all our polls are in. Thank you so much for doing our survey. And with that, Lonnie, do you have any closing remarks as we are at 11:17 of our presentation today?
Oh my gosh, we are going to be able to give back 13 minutes of people's day. I am amazed. I am so very grateful. Is there anybody that is logged in right now that would like to say a few words? You know, raise your hand and Tish will go ahead and unmute you because we have a few more minutes.
Okay, let me just go ahead and see. Okay, I cannot see anyone else at this time. But Auntie Jessie asked Lonnie if you could please update us about the luminaries.
Actually, Tish, I think you might update us on the luminaries.
You know, I was wondering when that was going to happen. I knew she was going to pass that right over to me, just as she did for Gail. So for everyone joining us, Auntie Jessie is talking about our event, the Celebration of Life, our floating lantern ceremony. We are able to have the lanterns available online at our hawaiicarechoices.org website. Please click on the tab Celebration of Life. We're so thankful that we are able to offer the luminaries to all of our community to purchase online. Chris Spiegel, our wonderful title sponsor, has allowed us to pick up and drop off from his office on Monono Street. So again, if you purchase the lanterns online at hawaiicarechoices.org, you are able to pick up, take it home, decorate it, and drop it back off at Chris Spiegel. I will let you know, though, today is the deadline for it. So just for the people that are attending, I am going to give a one-day extension. If you would like to purchase your luminaries, please do so today on our website. Pick it up at Chris Spiegel's office on Monono Street, right across from Hawaiian Style Cafe. And go ahead, decorate it, drop it off by tomorrow, and we will be able to float the lanterns out on Reeds Bay at an undisclosed time. But we are so thankful to be partnering with Naleo TV, and you can catch the entire event, Channel 53, May 30th at 6 o'clock. Thank you so much, everyone. Yay! Give yourself a round of applause.
I wanted to just add to this year, because we're doing a virtual thing, we have some goodies that you can also purchase online from us. We are offering the delicious Andagi donuts from Punahongwanji. They're going to be making that for us, and we are selling tickets online for that, as well as delicious bento from Cafe 100. And so, Tish, how do they go about to get that, and where do they pick it up?
It is the same tab, Celebration of Life tab, on our hawaiicarechoices.org website. And if you scroll down to purchase your luminary, you'll be able to see the Andagi donut tickets and the Cafe 100 tickets. And oh my goodness, Chris at Allstate is having us pick up all of the wonderful items at his office, and he'll even give you a goodie bag for picking up your things. So go ahead and visit him. Chris Spiegel at Allstate.
When is the pickup time for the bento and the Andagi donuts?
Pickup time for Cafe 100 bentos will be on Friday, May 20. Oh my goodness, you're making me work. 28th, I believe, but that Friday before the 30th. And pickup times are during 7 a.m. to 7 p.m. Again, just as a reminder, it is on your ticket as well. If you just paste that to your refrigerator as a reminder, Andagi donuts will be available to pick up on Sunday, May 30th, from 10 a.m. to 1 p.m. And that's at the Punahongwanji. Again, tickets have all the information, and I hope you guys are able to get that. Maybe I'll see you and I'll just wave to me and say, hey, Tish. Or maybe you'll see Lonnie picking up your Andagi donuts, because I know we'll be getting those as well.
Yep.
So thank you so much. Thanks to everyone. I hope you are able to tune in again. And with that, I would just like to say thank you so much for everybody for tuning in. We will give you back 9 minutes of your life. Please go ahead, take some time to breathe, drink water, do what you need to do. Have a wonderful week and weekend also. And we'll see you. Don't forget to tune in the Leo Channel 53 for Celebration of Life. Aloha.
Aloha, everyone. Aloha.